Hey guys, so today we're going to go over how to learn BLS in 5 easy steps and then the 2 actions you have to do. Now, I'm teaching you guys this, how to pass your exams, how to impress your preceptors or providers or whoever is testing you or working with you, and it shows that you know at least the basics of basic life support. You could be a medical student, PA student, nursing, or just a lay person that wants to know basic life support and get certified. Now, in the next videos in this series, we're going to go over ACLS and we'll go into PALS and other stuff like that, but we want to start off with the basics, okay? So the first thing, when you have an unresponsive patient, lying on the floor and nobody knows what's going on, you have to assess for responsiveness. Okay, you need to get a response from the patient. Now, how are you going to do this? You can't just say, I'm going to get a response, right? I'm checking for a response. How are you checking for a response? So there's 2 things. You need to shake and shout. Okay, that's how I memorized it. So you have to literally shake them. You can't just tap lightly on their shoulder. That's not good enough. You have to take your 2 hands and shake them by the shoulders, shake their chest, see if they are responsive to your movement or your pain. And at the same time, you're going to shout at them and make sure, they're not going to make sure they're not just deeply sleeping, right? And you're going to shout. If you know their name, great. If you don't, just say, sir, are you okay? Or ma'am, are you okay? Can you hear me? Shout it. Okay, shake and shout. If no response there, you right away have to call for help. You do not, I remember what my preceptors told me. They said you do not want to be alone with the patient, okay? You need somebody else there with you, so you shout for help. Okay, when you're shouting for help, you don't just say help, okay? You're going to ask for something specific. So it depends on your setting. You're either going to call a code, you're either going to get a crash cart, right? Scream, get the crash cart, or you're going to get the AED, okay? If none of those are available unless you're in the street, then of course you're going to ask somebody to call 911. So either one of those is good, but you can't just say I'm calling for help. You have to be a little specific. So I just like to say, get the crash cart because I'm, let's say, in the hospital setting. Now, after those 2, you are then going to check a pulse. Okay? And the mnemonic for the second part after, these 2 I kind of put together, check for response, call for help. The mnemonic for this is CAB. C stands for circulation. Circulation, how do we check for circulation in a person? You check their pulse. Okay, how are you going to check the pulse? You're going to take your 2 fingers and you put it by the side of their neck at their carotid artery because you're checking for a carotid pulse. And that pulse, you have to verbalize at least that you're checking for at least 5 to 10 seconds. Okay, it's not good enough to just put your hands there for 1 second and move away. You have to say, I'm checking for at least 5 to 10 seconds. Okay, next step, no pulse or somnolence. You could do the next, all of these steps you could kind of do together, but just for memorization purposes, you memorize them separately. But you could really assess a pulse and check for A, which is airway, at the same time. So airway, you are going to put their head in a position that opens their airway. Okay, so you're going to tilt their head back. And this just opens, the trachea and the oropharynx so they could breathe easier instead of just staying in like a stuck position. You're opening it up. So if you're scared to do this, that is fine because, sometimes there's trauma. You don't know if they just like fell from a roof or something. So you have to be very careful. So if you know it's non-trauma, I'll just put 2 directions over here. Non-trauma, that means we're not worried about their cervical spine, their C-spine, or trauma. So if it's trauma, you do a modified jaw thrust. And if it's non-trauma, you do something called head tilt, chin lift. Okay, you could look up pictures or maybe I'll insert pictures of the difference between these 2. And this just opens the airway, one in a way that, we're not worried about the cervical spine fracturing that more. And then the other one is being careful of the cervical spine. And now the last B is for breathing. So you have to assess if the patient's breathing or not. How are you going to do this? You are looking for chest movement. And I'm sorry, guys, for my terrible handwriting. Maybe one day I'll type this up for you guys. So chest movement, you're literally just looking, is their chest rising and falling, rising and falling? That would be a great sign. If you don't have that, that is bad, okay? So if pulse and breathing are not happening, right away, you need to perform CPR, or if somebody else has joined you, ask them to start, okay? You're doing it, the ratio is 30 to 2 for an adult, right? We'll get to kids in a different situation. 30 compressions, 2 breaths. Okay, 2 breaths. Okay, and the breaths, you have to, basically, you're going to hopefully have a bag valve mask, BVM mask. Make sure it has a tight seal. around the patient's mouth and nose, so the ear could actually go in, and you're going to be checking for that chest rise when you deliver the breaths. Now, you have to be doing this for a total of 2 minutes. That is the CPR cycle. And while you're doing this, to pass your exams, you have to say out loud, make sure the compressions are going 2 inches deep and they're going hard and fast, especially if you're the team leader, okay, which we'll get into soon. If you're running a code, you have to tell the person who's doing CPR, hard, fast, deep, okay? And additionally, every 2 minutes, it's supposed to change people so nobody gets too tired. So every 2 minutes, say switch, okay? Now let's get into the AED, right? AED rules over the CPR. That means let's say you're just, 5 compressions in and someone who you called for help got the AED, you right away attach the pads. Okay, the pads will show you, let's say this is the chest, right? That's usually the placement, but the pads will show you on them. There'll be a little picture of where you're supposed to put them on the body. Follow the directions on the AED that you have. You attach those, and the AED will analyze, okay, and we'll see if it wants to deliver the shock or not. If it delivers the shock, great. Everybody stands clear. Nobody touches the patient. Delivers the shock, and right away you continue CPR. No break. Now, if the AED says no shock advised, you just continue CPR. Okay, you don't just sit there and wait 30 seconds, right? You continue CPR right away. And you go back and forth in the cycle. CPR 2 minutes, AED check. Deliver the shock or not deliver the shock. 2 minutes of this. Okay, back and forth until, either the patient regains consciousness, starts breathing and has a pulse. Of course, doing pulse checks every 2 minutes to make sure the patient didn't just randomly get a pulse again. And that is basically BLS.